We will have Miss Laura Bracken, excuse me, Miss Gomez, and Miss Boswell. Could come to the table. If you all can introduce yourself, and then whoever wants to start.
Do you want me to start? Good morning, Chairman and committee members. I'm Laurie Boswell. I'm the CEO of Holy Angels in Shreveport. Although we are located in Shreveport, we do serve individuals from all over the state, and actually we care for individuals their families live in the districts we're served by many of you on the committee today. We are a nonprofit that was established in 1965 by the Catholic Diocese, and we continue to serve today as an independent nonprofit focused on our legacy and serving a broad spectrum of individuals. 180 individuals, about 100 of them live in the community, in community homes, but we have about 80 who have complex behavioral and medical needs. And so we are a quality-focused organization with excellent programs tracking hospitalizations, the reasons for ER visits and hospital visits and stays, and trying to avoid that at any cost. We also are an organization that is focused on community integration, and we have many programs where we serve people who live in their home in the community. Rather than go through all of the great programs that we have, I'd like to focus on our medical care for a moment and to tell you about Caitlin. Caitlin's story is one of a young person who came to us from the neonatology unit as a baby and stayed with us until she was 22. Caitlin was severely disabled with cerebral palsy and blind. She suffered from continuous and severe seizures. And throughout the years, she would go in and out of the hospital, and each time our staff would go. As a matter of fact, those that many times would work their entire shift, clock out after hours, and go to the hospital to be with Caitlin. As her condition really worsened, our director of nursing, who is an ICU-trained RN, found, along with these great direct service professionals, that if we held Caitlin and soothed her, that her seizures would lessen. Finally, she was hospitalized again, and the hospital told us that the end was near, and we brought her back to Holy Angels. That morning at 3 a.m., the nurses called our director of nursing, and she drove in the middle of the night to come there to be with Caitlin. Caitlin died in the arms of a nurse, surrounded by direct care professionals, knowing that she was loved, surrounded by her family. Her family was not an option there. Her mother was incarcerated, and her grandparents had passed away. So we were her family. And I will say to you today that I know that Holy Angels is special because of those direct service professionals and the skilled staff that work there. They remain true to our legacy of excellence and compassion. These are our statewide heroes, and frankly, they really deserve to receive a living wage. And this is part of our mission, to focus on those we care for, and also to be a benevolent employer of those who work for us. The funding is required to maintain this level of care for these 80 individuals who have complexities. We employ RNs and LPNs, but in addition to that, we pay medical directors, internal medicine physician, a neuropsychiatrist, occupational and physical therapist, exercise physiologist, a team of skilled professionals necessary to keep this individual healthy and out of the hospital. So when you think about Caitlin, you can think about the team that served her. Although she came to us as a baby and was 22 when she died, she really looked like she was about 3. She was a child of God and deserves all the care necessary. The tragedy of our story continues. It doesn't just stop there, because in 2008, our reimbursement was cut and never restored. And so today, we are reporting our audited financials. Last year, we lost from operations $1.3 million. The level of Medicaid provided does not cover the care needed. We have a cumulative loss, these are audited losses now, of over $14 million since 2011. So we ask you, why is this occurring and why does it continue? And we ask you to consider funding the services of individuals with disabilities, for these are truly God's innocent children and many of our most critical and vulnerable citizens. We ask, why are they left in this situation? So when I talk about their needs, and I think of those that we serve, it's not just the children who have total care needs, but it's also those who are older, who are aging in place. And I have literally been at the bedside of those while they have passed away. And so when you think about Holy Angels, think of a provider that's efficient, that has a return on investment to the Medicaid system across the state by reducing hospital days and ER visits. Think of a spotless environment, a legacy of love and excellence. And think about Caitlin and her story and the many who are still there and the many who will come after her. We ask you to please, when it comes time to vote, remember this. Remember Caitlin and the many who need this level of care. Remember Holy Angels. Thank you.
Hi, I'm Jennifer Hebert. I am the Executive Director at Magnolia Community Services. We serve adults with intellectual and developmental disabilities in the greater New Orleans area. Specifically, we're in Chairman Henry's district. And today I'm here on behalf of all Louisianians with intellectual and developmental disabilities. At Magnolia, we've spent countless hours working collaboratively with other area agencies and the Community Provider Association to better the lives of the people we serve. And I can speak with confidence on behalf of all of our organizations when I say we are immensely proud of the work that we do. We know that making a vision a reality doesn't simply happen. It's a shared endeavor that can only come about when everyone works together. My hope today is to convey to you how important the services we provide are to thousands of individuals and to remind you how vital your support remains. For over 80 years, individuals with developmental disabilities have called Magnolia home. Today, there are 144 individuals in our residential program, which include during the day, we serve additional 150 individuals in our day programs, which include a variety of vocational services, supported employment, and volunteer programs. Clients in our day program access the community each as which the population will serve to reach their greatest potential. I'd like to give you a little bit of insight into how facilities like ours are funded. We, like almost every other ICF in the state, are a nonprofit organization, meaning there are no major salaries that we pay to owners, no shareholder dividends, no profit maximization. We are all mission-oriented, not profit-oriented. We are driven by the desire to better our community rather than a bottom line. I do want you to know that our organizations are struggling, and not just Magnolia, but agencies all across the state are struggling just to keep their doors open. For instance, Magnolia lost $1.7 million last fiscal year on a $12 million budget. However, we have made an unwavering commitment to our clients, their families, and the community. People rely on us and the services that we provide. And while sometimes the future does look grim, our services are more needed and more in demand than ever before. Magnolia alone has a waiting list of 227 people. So now I'll try to explain why we lost $1.7 million last year, and why the majority of the ICFs and agencies in this state are in the same boat. In 2008, we had a crisis in terms of funding, and our reimbursement rate was decreased and frankly has never gone back up. No increase in 12 years. In addition, medical costs have drastically increased over the past 12 years, up 37% from where they were in 2008. I will say this, though. One, that our costs have increased was our decision last fall to increase our minimum wage to $11 an hour, a living wage, in order to attract and retain the most qualified staff. We tacked it onto our loss because we believed that it was that important. So in short, when you have your costs rising, your rates decreasing, and zero restoration, you get a $1.7 million loss. We simply can't keep up with the rising costs. But you guys can help. 35,000 of our state's most vulnerable citizens are at risk. You can help by appropriating $43 million in state general funds to fund our services. Thank you.
So, thank you for having us here today. My name is Sharon Gomez. I am the Executive Compliance Officer for Evergreen Life Services. Evergreen is an organization that has enjoyed a 60-year history of providing services to people with intellectual and developmental disabilities in the state of Louisiana. Louisiana is our home. It's where we were first started, and we provide services in the community to approximately 600 citizens in Louisiana, and we employ approximately 1,100 staff in the state of Louisiana. These folks are your neighbors. They are in your neighborhoods. They are in your subdivisions. They are your constituents. We are also the organization that in 2012 took over the North Lake Supports and Services Center in Hammond, Louisiana, saving the state of Louisiana millions of dollars. And we were thrilled to be able to do that. Since then, we have actually closed that facility and moved people into safe and comfortable living situations in the community. And we were thrilled to do that. We, like Magnolia and Holy Angels, we serve some of the most vulnerable and needy people in the state of Louisiana. We do have a quality program and we are constantly internally looking at ways to improve our quality and look at ways to improve our services. We share the losses that have been talked about with Holy Angels and Magnolia. Over a 5-year period, our losses have totaled $7.2 million. as a nonprofit, we have the ability to fundraise, and we do engage in fundraising activities. And before 2008, our fundraising activities allowed us to do lots of extra things for those that we support and for our staff. But now our fundraising has to go in to supplement our budget so that our doors can stay open. Over the course of time since 2008, we have had to cut some programs that we were delivering because we just basically could not financially continue to do those programs. So we're here today asking you, pleading with you, to please restore our funding so that we can continue to operate, so that our doors can continue to stay open. 35,000 citizens with intellectual and developmental disabilities are counting on you to do what it takes so that their livelihood can continue. Thank you.
Thank you. We got questions, if y'all are okay answering a couple questions. Representative Bagley.
Thank you, Mr. Chairman. Ladies, a couple of questions I've got. First of all, you mentioned the ICF. What is an ICF?
It's an intermediate care facility for individuals with developmental and intellectual disabilities.
And if the audience doesn't understand how, and my fellow colleagues don't understand how serious this is, the lady from Magnolia that broke down during the testimony, I've heard Ms. Boswell do the same thing many times talking to me over the phone. That's how desperate they are to get our attention to know to what's going on. You mentioned that 08 funding changed, was cut. There's never been a rebase. What is a rebase?
It's a way that they take all the cost reports that are done by all the providers. They average those, and then they calculate a number that, based on what we're spending, what we should be receiving.
And that's Medicaid payments, correct?
Medicaid,
right?
Yes.
What?
And that is completed by and overseen by Postal Waite and Netterville. Our audited financials show that 86 cents of every dollar we receive goes directly to client care. Our cost report data shows what we're spending on our clients, so there's no question of what we're spending. And actually, Postal Waite and Netterville has looked at the books of several of us to see just that.
I know that there have been closures by ICFs throughout the state. There have been average about one a year, I think, maybe even two. Where do those children, and I say children, some are older than my age, where do those individuals go?
Well, I think when several of the facilities have shifted their clients, we, like, for instance, when there was a facility in Bossier that was taken over by the Ark of Acadiana. Some of those clients came to Holy Angels and probably to Evergreen and Magnolia too. We also have a significant waiting list, and we cannot take on any more individuals at this point.
And primarily the individuals that you care for would have trouble living out on their own, or maybe impossible.
Out of the 180, 80 of them have critical issues, behavioral issues, and the medical issues that I described. 100 of them will need supervision, and it's their choice. They make a choice whether they want to come into one of our community homes and take advantage of our day program and job placements and all the things that we offer, and the camaraderie of others in all of our social events. And then others in the community may choose to stay at home.
And there are some that really don't have a choice. They have to live with you.
Absolutely. Those that I spoke of the 80 with critical medical issues, The majority of them are without families. They may have been removed from their families when the baby was in the NICU, or their families have abandoned them.
And where would they go next if you didn't take them?
There is a state facility. Pinecrest, I imagine, would be the next resort for them.
So the taxpayers would have to pick that. That's the point I'm trying to make. Yes. I think y'all do an excellent job. You know that. The ladies I'm looking up here, I've never met the lady from Magnolia, but we all understand how that goes, and the emotional attachment that you have to your search. I know you've talked about money you've lost already this year. I'm not sure how you can afford to continue this work at those kind of losses. I think it's a desperately needed increases to help, and I know everybody that's in this room needs money. But when we're talking about the most vulnerable people in our state, people that cannot survive without help, I think that you'd be first in line. Thank you very much. Thank you, Mr. Chairman.
Thank you, Representative.
Representative Bacala.
Thank you, Mr. Chair. Real quick, have you guys had a chance to look at this year's proposed budget? I think y'all fall within the Office of Citizens with Developmental Disabilities, and I think your cries have somewhat been heard. In State General Fund, this year is proposed not 43, but an extra $9 million, which is a 30% increase compared to what you had last year. And overall, the program is scheduled, at least in the proposal, to receive about a $13 million overall increase. I don't know if you'll get it. You know, that's a broad category where other agencies are competing internally. I know my ARC is here, and I know every year they have fundraisers to make ends meet. You know how I know that, right? I get invited. Yes, as does my colleague. So we understand that the issues you have now, but I'm just going to opine for a minute. Again, while this small section of the LDH budget is scheduled to go from $153 million to $168 million in funding, there's another area of the budget within LDH that's scheduled to get $1 billion. And the part that's scheduled to get $1 billion in increase is where we've been finding all the difficulties. We recently uncovered nearly 1,700 people who are receiving services in Medicaid making over $100,000 a year. That was money you could have gotten. LDH recently uncovered through their audits that we forced them to do practically. We had to twist their arm. 30,000 people who were ineligible but receiving services $6,000 a year per person. The Louisiana Legislative Auditor found 19,000 people prior to that. And we have yet to look at more than 1/3. We've looked so far at 1/3 of the population receiving services. And people come before us, they say, you're trying to kick poor people off. No, we don't want $100,000 earners receiving a $6,000 benefit. And I hope one day that we'll all wake up and hold an agency accountable so that dollars can go to people like you who truly need it, instead of allowing others to cheat the system without consequence. So that's my opine. Thank you.
Representative, we are calling for funding for all disability services. We're asking you to appropriate those funds. We must have relief. We must.
We can appropriate, but you have to understand that that this legislative body by design does not appropriate down to the finest detail. We appropriate in big chunks. I hope that we can address that a little more closely this year. But when we appropriate to the Office of Citizens with Developmental Disabilities, it allows the Department of Health to decide within that broad category who gets it, whether it's Magnolia, Pinecrest, Arc of Ascension, Magnolia, whoever. So they have they have the authority within the Department of Health, their executive branch, to decide amongst those within this category who gets what, and we don't. And a lot of times I think you guys think that we're the ones that set how much money Magnolia is going to get or how much the Arc of Ascension is going to get. Ultimately, that's a choice of the Department of Health. They decide that we give them a bank account with a finite amount of money, and they decide where within that budget category the dollars go. And I think when the day we realize that it's the legislature is appropriating money, but somebody else has to be accountable for where that money's being spent once we authorize them to spend it. Thank you.
Dr. Bracken, you might could respond to that.
Hi, I'm Laura Bracken, representing the Community Provider Association. One thing I wanted to say is that the money that's needed to restore and rebase the rates goes into the medical vendor program. So it goes into that pot, not into OCD's pot. Another point that I wanted to make is that the three ladies that were up here today talking about the amount of money that they've lost, they're not the anomalies here. We actually pulled the tax reports for a lot of the providers that are operating in Louisiana, and 80% of them last year, 80% of them were operating in the red. That is not a sustainable system for our state. And when individuals are not able to receive services from one of these providers, which is our state's least costly service option, then individuals are forced to go into higher cost service options. So it doesn't really make fiscal sense to not fully fund your state's lowest cost service option. And then, like I said, 80% of the nonprofit providers last fiscal year were operating in the red. I haven't pulled them all for this year because they're not all posted, so I can't get access to them yet since it's too close to tax time. But I do plan to pull that information to see what the difference is. Many of those agencies have been operating in the red for multiple years, as they talked about this today, and their ability to continue to stay in business is limited. I actually met with one legislator who is a business owner, and I asked him, if you were a business and you lost $1.7 million last fiscal year, what would you do? And he said, I would close my doors. But when these agencies close their doors, it puts individuals and family members in a vulnerable situation, and it winds up being more costly to the state of Louisiana. Dr.
Bracken, I appreciate you being here. And I'll kind of repeat, to the degree that the money comes from the medical vendor has anybody sat down with the powers at LDH and said how much of that $1 billion increase is going to be dedicated towards serving our needs? And has LDH, if you have asked that question, what's been their response?
It's my
and our friends, and we're not barring out. You're gonna need to help me to decipher a budget that goes up $1 billion, but none of it. It doesn't even say who it's for, really. It just says that's the medical vendor payments.
In that budget for home and community-based services and intermediate care facilities, but it doesn't include, to my knowledge, it doesn't include the amount that's needed to restore and rebase these rates.
Well, there's no specificity, again, that we provide. We give the Department of Health the authority, assuming the money is present, we give them the authority to spend an additional $1 billion without giving them any restriction on where that can go within the broad category of medical vendor payments. So they would have the option, I think, of increasing spending where you guys need it. But you're even within LDH, you're competing for dollars with others. But again, if we're giving an additional $1 billion, then I think that y'all need to speak to hopefully LDH and say what's our share. Thank you, Mr. Chair. Thank you, Dr. Bracken, who you're always very, very helpful, and I appreciate it. Thank you.
Gotcha, Representative Edmond. And members, I'm happy to take as many questions. We have 4 questions for these witnesses, and we have a significant amount of people who still want to testify, so please understand that. Representative Edmonds.
Thank you, Mr. Chairman. It is hard to be quick, but let me just do this I only have one question that I want Dr. Bracken to answer to, but we appreciate your passion at the table today. And I know this has nothing to do with necessarily with question and answer time, but it's very little we can do today than otherwise to try to provide encouragement to you that our ears and eyes are open. We're working behind the scenes. I've met with Representative Bacala, Representative Foyle, and others. We're behind the scenes knowing the struggle that you're in. Sidebar, one of the best Baptist members that I know, and that's my profession, is at Holy Angels. And his name is Cheston Heron. He's been a lifer there. And I wanted to encourage you today because I know that it's so difficult for you to be here. It's not that I want to play favorites, but Cheston has always been one of those developmental, difficult children in a sense, but is the greatest encourager I know. And so I appreciate the life that you provide for him, and I'm well aware of it over 3 decades, so I appreciate that. The $43 million was what was mentioned. Could you give us an idea of what would that bring you up to, what should be in your analysis is the correct rebased amount?
Yes, and I want to clarify the $43 million a little bit. $43 million was the amount that the dollar amount that we had gotten from the department several months back, and more recently the department has referred to the amount that's needed to restore and rebase as 38.8. And so you might hear some people say 43, some people say 38.8, but 38.8 is the accurate number. And that money, what that would do is it would restore the rates that had been cut. So in 2008, when the waiver rates were cut, they were cut to about where they were operating around 2002. And so it's like operating on a 2002 rate. But they were cut in 2008. This money would restore and give them back the rates that they were getting in 2008. So it doesn't bring them up to a rate that maybe would be an appropriate rate today. It just restores what was cut for them. And that's for the waiver providers and the support coordination providers. For the intermediate care facilities and community homes, the state plan that's submitted to CMS requires that the state rebase the rates every 3 years. Those rates haven't been rebased, but it is contingent upon appropriation by the legislature. Those rates have not been rebased since 2008. And so if the rates are rebased, it will be based on the most current audited cost reports. And so it would bring them closer to a more appropriate operating rate. It still would not be, perfect, but it would allow these providers to not lose as much money and to be able to hang on until things can be, the rates can be made appropriate.
Do you have this synopsis or analysis in a written form?
I can get it.
Can you prepare a backgrounder for this?
I sure can.
Mr. Chairman, I'd like to request that every member receive a backgrounder for this information. I know that we'll have LDH back at the table. So part 1 and 2, I agree with Representative Bacala. Wherever you can apply pressure, that's just what it is. And I know everybody in this room is applying pressure. I assure you that we will do our best to, again, if you would provide us that backgrounder, and I would for every member, because I don't know of anybody that's not in favor of trying to help everybody. But if you would do that, we will have it for our next discussion with LDH. All right. Thank you, Mr. Chairman.
Yes, sir. Representative Billiott?
Yes. Thank y'all for coming here today. We had an opportunity to visit with you earlier. So, and we spoke about the bill. Isn't there a bill out there that y'all really are supporting? Would you explain the bill somehow?
Yes, House Bill 390 by Representative Melinda White. And what that bill is it's a rate methodology and reporting bill. What it does is what made us want to proceed with getting that bill in this session is that it's really kind of frustrating. Every year we're spending so much time trying to educate legislators or fill them in or keep them up to date on what's happening with the rates and how far behind they are. And it takes a lot of time and energy. And so what that bill would do is look at what are the rates, are they adequate? Could we have an agreed upon rate methodology that makes sense to everyone so that all right, this is based on certain factors. And then more importantly is it would have a reporting structure attached to it. So you would get the information about the rates and whether they are adequate or not adequate, and you would get that information 45 days prior to the start of the legislative session so that you would have the information that you need in order to make informed decisions.
So, Mr. Chairman, would you know where that bill would go first? Would it go to Health and Welfare? Okay.
It's scheduled for Health and Welfare on the 24th.
Okay, and I mentioned when I went over to the to Manolia was that it would be important that when that bill goes in front of that committee that you show the force that you have now, and that to try to, the idea is to get it out of committee, get it on the House floor so we can vote on it. Mm-hmm. That's, now you would say, well, that's your job to help us do that. Well, we will, but you need to contact the individuals that are parents or associated with this, and like you said, some of them they're no longer. I mean, this is their whole life now. I mean, they have no other place to go but to stay with y'all. So we need that needs to be brought out more to the committee and those things, and try to get it out of committee so we can get it on a House floor. And that's going to be really the last time you're going to be able to really openly discuss it is going to be in that committee meeting like you're doing today. And so that's what's going to be important, is to get it out of the committee meeting, and then get it on a House floor where we can vote on it. So you can see honestly, who's there, who's not there. So next year, if it doesn't make it out, you know who you have to go work with. So that's where we're at now with what you need to be able to do. And of course, the questions and the information you're going to leave or get back to us. So when the health department comes back up here, hospitals, and we're going to be able to get to the bottom of where we are exactly. But that bill is very important to keep moving.
And I just want to make a comment about the bill. Right now, it looks like the language isn't clear in that bill that it should not require a fiscal note, and so we are working with the department to try and get an amendment to make sure that it's clear that that particular bill is about the methodology and the reporting, and not about funding. And so the funding that is needed, the $38.8 million, that money would need to go into House Bill 105. But
really at the beginning of the conversation, not while we are, here. It needs all that needs to be put together prior, so when that bill comes here, it's already included where we can move more with it. Trying to add to it now, I know we discovered some more money that's going to be coming in, REC, but rest assured there's a list from here to back to Jefferson Parish on how many people are coming, so we have to have that included at the beginning. So good luck with that bill, and we're going to be voting for it.
Thank you very much.
Thank you.
Representative Miller.
Thank you, Mr. Chairman. Good morning. Do you know if any other states have any stat dads that go directly to rebasing home and community-based services, or any type of service to where y'all can put into a fund to where we can use for matching federal funds?
Different states do things differently, and yes, there are states that do have some dedicated funding streams for the services for individuals with a developmental disability, and it varies from state to state how they do things. So, for example, one state, has lottery money that goes, to a portion of the lottery funds goes to services for individuals with a developmental disability. So it's different in each state. And I could pull that information if you...
Do you think Louisiana is maximizing our federal funds, our federal dollars, with matching dollars to rebase you?
I believe so. I believe that the state is maximizing.
So as we're talking about, and my colleagues keep mentioning the $1 billion, the majority of this $1 billion that they're referring to is federal dollars, and it's monies that are being used to bring down matching funds. So that's not the state general fund dollars that we're saying, hey, we're giving this $1 billion to certain organizations, and we're not giving it to home and community-based services. So as we talk here, I don't want y'all to be misled and think that the 1,700 individuals who were caught with Medicaid fraud, that those dollars could have been going to you all, because that wasn't state general fund dollars. The majority of the Medicaid expansion population where we're catching the fraud is federal dollars. So every time we catch those individuals, that money cannot be redirected to you all. So I just want to make sure that that's clear, that y'all understand that it's not fraud that's keeping y'all from being able to be funded. But coming back to what we was talking about, the Ohio passport waiver, are you familiar with it?
Not intimately, no.
Okay. There's $8.1 million in significant revenue changes that DHH proposed, and in that, it has for the Office of Citizen with Developmental Disabilities Do you know how much of that y'all are getting, and is it gonna help you?
So that money that's specifically in OC2D's budget, is that what you're saying?
I'm not sure. I'm looking here at, it says there's an increase, and mostly comprised of an increase in medical vendor payments, interagency transfers to the Office of Behavioral Health and Office for Citizens with Developmental Disabilities. It will reimburse these agencies for statewide adjustments.
Now that would not go to restore and rebase these rates.
Okay. Have y'all ever considered or talked to DHH about any statutory dedications or possibly developing a trust fund that you all can maybe tax yourselves and in return draw down extra federal dollars?
We've talked to the department on numerous occasions about a lot of the issues related to these services, and there is the waiver fund that has been used to fund, like, for example, the night rate last fiscal year. And so we've had conversations with the department on those things, but not about any new fund, no.
And it's just a suggestion. As I've been talking to several home and community-based businesses, if you look at other places in healthcare that are getting extra funding dollars, it's actually federal dollars. Our state general fund for DHH have actually not grown that much this year, but we're leveraging matching funds to get more federal dollars for the hospitals and different reimbursements. I think Kevin has something.
Well, Kevin was reminding me that we did try to push forward with a provider tax several years ago to try and pull down some additional federal funds, but we weren't able to get anywhere on that one.
Are we taking any steps this year to push for it again? Come on, Kevin.
Here, Kevin, you take.
Well, and listen, I'm only asking because I personally think that's the tool to get your reimbursements rebased and to get some extra funds is actually to leverage what monies we have to get down extra federal dollars.
Thank you, Representative Miller. And Kevin Hayes on behalf of the Community Providers Association. About 3 or 4 years ago, we met many times with the Department of Health, Mr. Russo, their executive counsel. We had conversations with their lawyers up in Washington, D.C., looking at the federal code and the provider taxes that are allowed. And although I was of the legal opinion that we could do this, the Department of Health was of the legal opinion that we could not do a provider tax on these specific providers. So without DH being on board, it wasn't going to go anywhere.
Well, I just recommend that we maybe come back to the table and revisit that. As I'm looking through the budget, everyone who are getting pay increases, the majority of them, are because they have leveraged their dollars to get extra federal dollars to come in. So I encourage you to let's bring that back to the table and let's continue searching to see where we can develop a fund source or some stat dads to draw down extra federal match.
We're flipping every pillows on the couch looking for change, so we'll certainly do that.
Okay, well, thank you.
Representative Cheney, Representative Miller, you finished?
Yes, sir.
Gotcha. Okay, Representative Cheney.
Thank you, Mr. Chairman. I'd like to direct this question to Ms. Bracken, please. Morning again.
Good morning.
Ms. Bracken, it's my understanding that there is a pot of money somewhere between, I'll just use these numbers, $8 to $9 million that is in LDH's budget from last year that was supposedly going to flow through, as I understand it, to your providers and group. And so I'm just wondering what is LDH's reason at this point in time that y'all haven't received that money, if I'm correct about the position it is right now, and was it contingent on REC recognizing additional funding before you're able to get that money? Am I anywhere in the ballpark there? Could you enlighten us a little bit more about that, please?
There was some funds that were appropriated last fiscal year from the New Opportunities Waiver Fund that the department was using to try and do a partial restoration of the rates and to also address some of the complex care needs of folks who were receiving waiver services. And so the department was waiting on REC to recognize some funds to be able to make some of the adjustments. And and then they have actually moved forward and made some adjustments for April, May, and June.
So what you're telling me is they are in a position or are getting in a position to send that money out, because I know the providers, especially in our area in northeast Louisiana, are on life support. You know, they're beyond a Band-Aid, and they need a tourniquet to keep from bleeding out right now. So, you know, if for some reason that's being slowed down for some sort of internal LDH policy or whatever, if we're in a position to send that money out, I want that to happen. So I'm going to ask you to keep us advised and let us know what we can do to push that forward, because it's just vital to survival up there.
Yes,
Okay.
sir.
Thank you, Mr. Chairman.
All right, Representative Bacala.
I'll pass.
Oh, all right, Representative Simon.
Thank you, Mr. Chairman. Dr. Bracken, it's good to see you again. I just want to follow up on that $10 million that Representative Cheney was talking about. That doesn't really do anything for the rebasing, though, does it? It just kind of just a Band-Aid, but it doesn't really give you a long-term fix, correct?
Right. Well, so there's two pieces. One is there was a little bit of money that the department did identify within their budget to do a partial restoring of the rates for the waiver providers for April, May, and June. But that doesn't do anything for the ICF providers. And so, like, the Community Provider Association represents a spectrum of services to meet a spectrum of people's needs. And so support coordination, home and community-based waivers, and intermediate care facilities. And so that those waiver rates that were restored for April, May, and June, it's temporary, time limited for those 3 months, which is almost like kind of like a shot in the arm, just to kind of keep some of them afloat until we can get a more long-term solution. But it didn't do anything for those ICF providers whose rates have not been rebased.
And that's really what the crux of this discussion is today. So I just, where I appreciate the $10 million, and it's good, and we tried to get it last year, and for whatever reason, you were sitting through it all. We know where it ended up. But with that said, we're still here looking for the long-term solution. Correct. And if we want to keep these ICFs afloat, that we have to address it in a meaningful way, not simply a shot in the arm just to get us through. So I don't want anybody, and I know Representative Taney wasn't thinking this, but just for the rest of the committee and for everybody else out there to know, this is not the answer, and it's far from being the answer. And that, this community right here has been somewhat put on the back burner or just forgotten about in many ways. And I don't think it was purposely on anybody in here, but the fact of the matter is y'all here today in force because this is a live and a real need. And just wanted to make that point that, as much as you can appreciate the money, I'm sure, we're still looking for long-term solutions.
Yes, thank you.
Thank you, Representative Simon.
Okay, Representative Bacala.
Dr. Bracken, specifically, if you had the money available, where would it go in the budget? I know you're very familiar with budgets.
It would go in the medical vendor program budget.
Into medical vendor? And that's why I said that we're talking about increasing the medical vendor program by $1 billion this year. So that it kind of gets a little confusing. So you think the Office for Citizens with Developmental Disabilities is okay today?
What do you mean?
Well, I know you're saying you need it in medical vendor payments, but the other category is not in need. The Office with Citizens with Developmental Disabilities.
I'm sorry, I still missed your question.
I'll skip the question. Okay, I'll just go back to you saying you need additional cash in the medical vendor payments category. I'll go back once again and note that category in the budget that's before us today is going from $12,381 million to $13,367 million. Do y'all expect that's in the broad category? That's for everything. That's for MCOs. That's for nursing homes. That's for everything. How do you make sure you get a little piece of that $1 billion increase?
If I may, Representative Bacala, Matthew Walsh with Easter Seals, Louisiana, and I'm by no means an expert on the budget, but we'd be happy to work with LDH between now and the time the bill passes out of committee to figure out how to just do that. if I understand correctly, within medical vendor payments, I believe a majority of the $1 billion increase is within federal funds with respect to expansion of Medicaid. I could be wrong. But my understanding is I think the department would be amenable to some sort of line item within the budget or within medical vendor payments to tie the specific dollars of the rate increase to providers, because we have to have as I understand it correctly, you have to have some state general fund to draw down the federal match that's necessary to actually rebase the rates. But we definitely would want to make sure we protect.
Well, I
those
think
dollars.
you need state funds, and in particular, it looks like this budget proposes an increase in state effort, not necessarily state general, by about $165 million, which I think I got to talk more to them about that. I'll also, I think this category in the last couple years. At the end of the year, they've had $135 million unspent and $192 million unspent. So say the money's not been available, maybe it just couldn't be used for your program, but they've had leftover cash in that category 2 years in a row at least. So you know, it's hard to justify needing more when you can't spend what you're spending now. So anyway, that's all complications. Thank you, Mr. Chairman. Unless y'all want to talk about it, I'll move on.
We'll work with the department offline as well.
Okay, the board is clear. Thank you all.
Thank you so much.